It's an absolute pleasure for me to welcome today Dr. Anas Aburruman, a highly trained oncoplastic and reconstructive breast surgeon based in Amman, Jordan, where he practices oncology at the Royal Medical Services, today in India, Pune, at Prashanti Cancer Care Mission's 3-day breast cancer conference. Dr. Aburruman holds both a European board certification in breast surgery at the Jordan Board Certification in Breast Surgery, reflecting his commitment to international standards of excellence in breast cancer care. He has also completed advanced training in multidisciplinary breast health and oncoplastic surgery at the Senatuk Academy in Istanbul, where he specialized certification in breast ultrasound. Today in the morning, we're going to have a conversation with Dr. Anas on early detection of breast surgery, screening, and reducing and preventing breast cancer deaths. So, welcome, Dr. Anas, to India, and I hope you're enjoying your trip over here.
Thank you. Thank you very much for this meeting and for this great opportunity. And thank you, Ms. Lale, and for Dr. Kobikar also for kind invitation to be part of this distinguished and excellent conference. Really, it's our pleasure to be here in great India. Really, India is a big school in medicine and in surgery, and we are enjoying our time to discuss with great expert persons in the world and in the from India also about all the development of breast cancer treatment and management and awareness also, which is the most important point in this field, really.
Very true, Dr. Anas. That's what I wanted to talk to you about, that early detection and early prevention. Don't you think that is the most powerful tool the women have against breast cancer?
Yes, thank you for this question. Really, I have a big comment about this point, especially in this modern era. We are in 2026, and from the 2025, the vision of the world really changed because the social media are present everywhere in the world. Also, the mobile is present in our hands for ladies and males and young age group, also even for the old age group. So all the ladies in the world, and I'm sure they know something about breast cancer, and they know the importance of breast cancer screening. But the main issue that's highlighted, and we have to focus on it in this year, that's why some ladies or significant percent of the ladies are not going to do the first step, which is the mammogram. Right. So all the ladies know very well about the importance of screening, but no one go for proper screening. So unfortunately, we are seeing a lot of difference in presentation between patients, that when there is awareness in the society, a lot of ladies, they are detected in the early stage or in the stage pre-cancerous stage,
known as
like
DCIS.
like stage 0, which means some also just some calcifications in the imaging studies, which means we are dealing with curable disease and we can detect the cancer before invading the surrounded tissue, and we can cure this malignant cells without chemotherapy, with simple surgery, without bad sequelae. We are decreasing all the bad sequelae of this malignant cells, and we can treat our patient in a smooth way. The patient will be happy and satisfied, and everything will be fine. And I have a comment for the ladies, if she hasn't any symptoms, so I encourage her to go for breast cancer screening and to do the first mammogram. This has two possibilities. The first option, the first one, most probably she will be normal.
Yes.
So most of the ladies without symptoms, her mammogram will be normal, and this is extremely important to be like a baseline for her future. And the second one, or the second point, maybe to have a pathological finding, and I'm sure 100% the finding will be very early stage of breast cancer, most probably will be just calcification in the 0 stage, or just a small cancer in the stage 1. So most of the screen detected cancers in the world, in the most modern countries also we are talking about, and there's a lot of published data about this point, the screen detected cancers are from the stage 0 and stage 1. So I'm advising anyone to go for breast cancer screening. Really, we are jealous from ladies, because in males, for example, prostate cancer, we cannot detect it so early. But if I am alternative to, if I have advice to ladies, I advise them to go early for detection of the breast cancer at age of 40. And we have to make a comment about the starting age of screening. Before 2 years ago, the world was categorized into regions according to the starting time of breast cancer screening. For example, in Canada and North America and in Australia, and in UK, they start the screening at the age of 47 or 50. But after that, from 2 years ago till now, all the world has a lot of evolving evidence that there is very useful starting breast cancer screening from age of 40, because we have a lot of patients that detected in the age between 40 and 50, so we can prevent seeing a lot of local advanced breast cancer in the young age group from age of 40 to age of 50.
So some very, very important points Dr. Anas has made for us, and I correlate that. One is that we should start screening at the age of 40 for a mammogram, and women in India before 40 do a sonography. And also the point that if you screen regularly and you pick up a very, very early DCIS, which is a precancerous lesion, which could become a cancer or may not even become a cancer. And if it is a cancer in early stage, you need minimum treatment. You may not need chemotherapy. You may just need a lumpectomy. The treatment is not so harsh. So it's very, very important that this message that you have given the community is life-saving.
Yes, the other point that the small cancers, mostly we can treat it just by simple surgery.
Yes.
And mostly they will not need also chemotherapy. Significant percent of patient will be just followed by follow-up, just imaging studies and physician assessment every now and then, and just one tab hormonal treatment.
It's very, very good advice that Dr. Anas has given the community, which they also follow, that we try to follow in India, is to do an annual examination for a prevention. And if you pick up an early cancer, it's probably stage 0 or stage 1, and you hardly need any treatment. And Dr. Anas, I would like you to even let the woman know that how important is a self-breast examination for a woman, and when should she do it? And what do you advise in Jordan? When does a woman do a self-breast examination? How often in a year or every month? And is it after her periods? Could you expand on that a bit?
Really, this part of awareness is extremely important. Also in our country, we are doing this job, and it's extremely important, because breast self-examination at young age group can detect some missed cancers, because we know that the young ladies will not go for physicians to make a mammogram or ultrasound for her breast, because she's younger than 40s, and we know that the most common cancer increase with age, and it will come after age of 40. So what we have to do between the age of 25 to 40, those are 15 years, also is important. And we are started to see a lot of, or not uncommon to see ladies with young age group with a breast cancer, and unfortunately those group of patients will present it to our clinic with locally advanced breast cancer and large tumors. So breast self exam is extremely important, even if there is like small lump or large lump, mobile lump, it looking benign lump, it should be assessed by a physician. So early detection by breast self-exam will help too much, especially also in ladies with like family history, or when there is any risk factor for being a breast cancer patient. And we want to make a highlight about the important sentence that one size does not fit all, which means that we need to make a good awareness and to talk always about this point when there is a risk factors and a family history of breast cancer. In some ladies, the breast cancer screening at age of 40 is not suitable. We have to start before that by ultrasound and by MRI and by breast self-exam and maybe mammogram before age of 40.
Thank you, Dr. Anas. So it's often said that the breast cancer self-examination is to be done by a woman if she's getting her periods 5 to 7 days after her periods are over, and if she has menopause any particular time of the month. It's ideally done by yourself when you have soaped yourself in your shower. You use your right hand to examine your right hand, clockwise and anti-clockwise. When you have soaped yourself, your hand glides very well, and your left hand to examine your right breast from under your arm, clockwise and anti-clockwise. And then it's often recommended that you gently squeeze your nipple. If there's a discharge of clear water discharge or little bloody discharge, you need to see a medical practitioner. And if there's a milk discharge or any other color discharge, it probably is an infection and you need antibiotics. So it's very, very important to learn how to do a self breast examination every month. Dr. Anas, what are the lifestyle factors, for example, smoking or alcohol and all, which can can reduce the risk of breast cancer? So what are the things that you would recommend which are avoidable to prevent breast cancer?
Really, we know that there is a non-notifiable risk factor for breast cancer, but here we have to make a good comments about the modifiable risk factor for breast cancer. We have to start always by obesity. This is the main risk factor worldwide, and sedentary lifestyle.
Very true.
Yes, because obesity means more fatty cells. More fatty cells mean secretion of estrogen. Estrogen, it's working like a fuel for malignant cells to growth more quickly if it's present, and to trigger breast cancer occurrence in the breast. So we all together to fight against obesity. This is number one. And we can also, as a complementary talk for this risk factor as obesity, we have to encourage the physical activity and exercise, and regular exercise. Really, we need at least 30 minutes every day to do exercise, regular exercise, to shape your body, to decrease the fat accumulation in the body, which will have a very bad effect on your health status, not only on the breast cancer, also a lot of cancers in the body affected by sedentary lifestyle, by obesity, and by not doing physical activity. And the other point also, it's related to obesity and sedentary lifestyle, the type of food. So unfortunately, most of our society, for example, I'm talking about Arabian society, and I don't know if in India the same thing, but I think in India there's a high percent of people are vegetarian. But in our countries, a lot of fatty meals and red meats. So this will affect badly on the health status and on the breast cancer occurrence. This is extremely important point, that we have to make a balance in our diet. Vegetables is always important. Fruits, vegetables always will give a healthy body form, healthy lifestyle, and decreasing the fuel for breast cancer.
Thank you, Dr. Anas. Very well said. It's very important that it's often said that the fat in a woman's stomach the stomach area is high estrogen, and that's correlated. The larger your stomach, correlated to the lifestyle risk for breast cancer. And of course, as he mentioned, it's very important to eat food that is not carcinogenic or is less meat and more fruits and vegetables. It's often said that you should avoid smoking and drinking, which we're all aware of, and hormonal replacement therapy pills, eye pills, the birth control pills over long term, also at a high risk of breast cancer. And there are some things which we can't help, which are not in our control, like genetics, family history. Those are a few things that we can't control.
Also, I want to encourage the ladies for breastfeeding, because
Yes, that's a very
in
important
the
part, at
recent
least for 6
publication,
months to a
at
year.
least breastfeeding for 1 year and more is extremely important and will decrease the occurrence of breast cancer. The other point about
Having children
smoke-
early.
Yes, about smoking. Smoking will increase the breast cancer. There is new evidence about the increase of occurrence of breast cancer in the ladies. They are going to regular smoking. And about alcohol, because if there is like a regular intake of alcohol, especially around 50 gram daily, even in the lower doses, I think
It's a high risk.
Yes, there's increase in the risk of breast cancer.
Very well said. It's said today that alcohol is the new carcinogenic.
Yes.
Like smoking was.
Yes.
So, Dr. Anas, I also wanted to find out in Jordan, is it the family plays a very important part, like for a woman, like the father or the husband or the son? How important is it that they are involved in the wife's treatment, or they are the ones who make sure she goes for a preventive mammogram or a sonography? And what is the role of the family playing in a breast cancer treatment or the awareness?
What I want to say in this point really about the breast cancer nowadays, because a lot of social media, a lot of news in the TV also, it became like a social disease. Or the most important disease in the social media. So I think in the last 5 years, what I'm touching in our society in Jordan, there's a lot of support from parents, from the husband, from the brothers, to encourage the ladies to go for the first mammogram. And the most important mammogram is the first one.
Yes.
If any ladies have a courage to go for the first mammogram, and for sure, if she hasn't any symptoms, the results will be normal or precancerous pathology. So it will be very successful point for all the ladies to go for this.
The fear
step.
goes away.
Yes, yes,
The fear is of the mammogram, and in the olden days, the mammograms were painful because it had metal plates and they, kind of compressed your breast. But today, the mammograms are so advanced and they have a plastic plate on top, and they just very light compression. Everything is automated by the computer, so there is not any pain. And when you go and do your first mammogram, as you said, the fear goes away because you have a positive report, everything is clear, and that encourages you to go every year.
Yes.
Dr. Anas, on a closing note, is there any special message you'd give the women of India? Any message you want to give her about the screening or about looking after herself, or any message you want to give her?
Really, the important message I like to send for all the ladies in India and in the world, that the quality of life is extremely important. Quality of life means you have to go for breast cancer screening, because if there is any possibility for breast cancer in your breasts, it will be detected so early or in precancerous stage, so the treatment will be smooth, and the trip of treatment will be short, and the quality of life will be high, and the treatment will be successful, and the outcome will be excellent. And this is my message and my advice for all the ladies in the world, and especially to the Indian ladies, because we are enjoying showing the generous hospitality here in this distinguished conference with Lale and with Dr. Kobikar. Really, it's a great conference and a great statement here.
Thank you, Dr. Anas. It's a very, very important message to the ladies to do a preventive screening and to pick up a cancer very early because it's completely curable. Yes. And she should not be afraid because the quality of life is what is being maintained by the oncologists today. They make sure also if there's a cancer, her breasts are reconstructed. There is, the breasts are made to look as good as pre-cancer, and she has a full quality of life and a holistic quality of life. Thank you very much. Thank you very much, Dr.
Thank you. It's my pleasure. Thank you. It's my pleasure to be here. Thank you so much. Okay.